Hello everyone and welcome back to my YouTube channel Eduimagica, the medical mystery education hub. Today we will continue our discussion on Krok 1 Pharmacology MCQs. Before beginning, make sure to subscribe and hit the bell icon. So without delay or ado, let's begin. So the question number 71 states that a patient with epilepsy and depressive reaction has been administered a drug that reduced epilepsy manifestations and improved the patient's psychic condition. So we need to choose the drug from the following option. So in the question we have that the patient is having epilepsy and depressive reaction, and we gave him a drug that basically reduced the epilepsy manifestations and also improved the patient's psychic condition. So for this case we have a group of drugs that is known as anti-epileptic drugs. These anti-epileptic drugs are of different chemical structures. These are of different chemical structures. What they do, they basically prevent epilepsy. They basically prevent epilepsy. Now these anti-epileptic drugs, these drugs are classified into two major groups. These are classified into two major groups. We have drugs for the treatment of epilepsy with grand mal. Treatment of epilepsy with grand mal, and we also have treatment of epilepsy with petit mal. Now what is this grand mal and what is this petit mal? Basically, grand mal is basically type of seizure that involves or has a characteristics of tonic and clonic seizures. They have characteristics of tonic and clonic seizures. So what does it mean, tonic and clonic? Basically, this grand mal have two phases. It has tonic phase and it has clonic phase. In the tonic phase, the body becomes rigid. The body becomes rigid. Whereas in the case of the clonic phase, in the clonic phase, there is presence of uncontrolled jerking. There is presence of uncontrolled jerking. This is grand mal. What is grand mal? Grand mal is basically a type of seizures that involves tonic and clonic seizures. Now what is this tonic and clonic? Basically grand mal has two phases. It has tonic phase and it has clonic phase. Tonic phase is that phase in which body becomes rigid, and in the clonic phase there is presence of uncontrolled jerking. Now what do you mean by petit mal? This petit mal is also a type of seizure that is also known as absence seizure. That is also known as absence seizure, and it is basically characterized by unannounced lapses in consciousness. And it lasts for few seconds. what were the grand mal and petit mal? These were basically the two types of seizures. Now we have drugs that treat epilepsy with grand mal and the drugs that treat epilepsy with petit mal. Okay. Now those drugs which treat epilepsy with the grand mal we have in this phenobarbital, we have phenytoin, we also have valproic acid, and we have sodium valproate. Whereas in the case with the petit mal, we have valproic acid, we have clonazepam, and we have one more drug that is known as ethosuximide. Ethosuximide. Okay, these are the drugs that are used in the treatment of the epilepsy, or these are basically the anti-epileptic drugs. Now, in this, we have epilepsy with the depressive reactions. In this case, epilepsy with the depressive reaction is basically a characteristic of grand mal. Now we need to see those drugs that belongs to the first group. So in these we have phenobarbital, we have phenytoin, we have valproic acid, and we have sodium valproate. Now, which of these are the most commonly used drug? So in that case, the most commonly used drug is sodium valproate. Why sodium valproate? Because this sodium valproate, this sodium valproate inhibits These sodium valproate inhibits GABA transaminase GABA transaminase and produces accumulation of GABA in brain. And we all know that GABA is an inhibitory neurotransmitter that will basically inhibit the central nervous system. Once this GABA will inhibit the central nervous system, it will also decrease the activity of the brain, which will lead to the basically the improvement of the psychic state as well as the depressive state of the person. Now, let's see the mechanism of action in detail. Now, we all know that the most excitatory nerve cells utilize glutamate and most inhibitory nerve cells utilize GABA. Excitatory nerve cell utilize glutamate and inhibitory nerve cell utilizes GABA. Now, the glutamate receptor comprises of the three subtypes. These glutamate receptor comprises of the various subtypes, or basically three subtypes, and among these three, NMDA subtype has the greatest therapeutic importance. Among these three subtypes, NMDA receptor has the greatest importance, or the greatest therapeutic importance. Here, the NMDA stands for N-methyl D-aspartate receptor. It stands for N-methyl D-aspartate receptor. Now, this NMDA receptor is a synthetic selective agonist. This is selective agonist. Now, once these receptors get stimulated, it permits the entry for both sodium and calcium. Now, once these sodium and calcium both enters into the cell, what it do? It basically leads to the release of the neurotransmitters, that is GABA. Okay. Now, phenytoin, phenobarbital, and lamotrigine. These three drugs basically inhibit the release of glutamate. Glutamate release is inhibited by basically three drugs. We have phenobarbital, then we have phenytoin, and we have lamotrigine. These three drugs basically inhibit the release of the glutamate. And we also have benzodiazepine and phenobarbital that also increases the release of physiological amount of GABA. Now we have benzodiazepine and phenobarbital. What they do, they basically increase the physiological release of GABA. And we have a drug that is known as valproic acid. What valproic acid do? Valproic acid works similar to the sodium valproate. What they do? They basically decreases the they basically decreases the GABA catabolism. How they decreases the GABA catabolism? They decreases the GABA catabolism by inhibiting the GABA transaminase. That leads to the accumulation of GABA in the brain. So this was all about the question number 71. Now let's move to the next question, the question number 72. The question number 72 states that a patient diagnosed with morphinism has been admitted to the narcological department. A doctor noted a decrease in pharmacological activity of morphine. Repetitive use of a drug may result in tolerance to its effect, and this phenomena is known as. I have told you this question earlier that whenever First of all, in this question, we have been given that a patient is diagnosed with morphinism, means he has high amount of morphine inside the body, and he is admitted to the narcological department. And the doctor noted decrease in the pharmacological activity of morphine. The doctor noted that there is a decrease in pharmacological activity of morphine, and the doctor came to a conclusion that repetitive use of the drug may result in tolerance to its effect. That is why the pharmacological activity of morphine has been reduced. Now, whenever there is repetitive use of something, a body becomes habitual to that, and that is known as habituation. Earlier in the question, I gave you the example of alcohol, that a patient is taking alcohol on a regular basis. That will make him addicted to that alcohol. Or same case as with the smoking cigarettes. And this habituation is also known as addiction. This habituation is also known as addiction. Okay, you understand this question? Now let's move to the next question. The question number 73. We have done this question earlier. The question number 73. For this, refer to question number 53. Same as with the question number 74. Please refer to the question number 53. We have also done this question, the question number 75. For this, please refer to the question number 27, I think. But here I will give you a quick revision about this question. Okay. Now, in the question we have the patient suffering from stenocardia, and he takes isosorbate mononitrate. He was prescribed a complementary drug with disaggregating effect. Earlier in the question number 27, acetyl salicylic acid was given in the question, and the examiner gave the option that it will basically reduce the or prevent the aggregation of the thrombocytes. So it is basically the same question, but here what examiner did, that the examiner gave the acetyl salicylic acid in the options, whereas in the previous question they gave this acetyl salicylic acid in the question. So now we all know that acetyl salicylic acid also have basically the disaggregating effect. Now what happened is that during platelet aggregation we have arachidonic acid. This arachidonic acid takes part in the COX pathway. Okay. Now when the COX-1 pathway takes place, it basically leads to the production of thromboxane A2. This thromboxane A2 is responsible for the platelet aggregation. Now what acetyl salicylic acid does, it basically inhibits the process. When it inhibits the COX-1 pathway, then there will be reduced or no formation of thromboxane A2 and platelet aggregation would be prevented. Okay, this was about this question. For detailed explanation, please refer to the question number 27. Now let's move to the next question, the question number 76. The question number 76 states that a patient in postoperative period was prescribed an anticholinesterase drug for stimulation of intestinal peristalsis and tonus of urinary bladder. What drug is it? So in the question we have that a patient in postoperative period was prescribed with anticholinesterase drug for the stimulation of intestinal peristalsis and tone of the urinary bladder. Now, we all know that anticholinesterase drug belongs to a class that is indirect acting M and N cholinomimetics. Now, in this group, we have a very famous drug that is prozerine. This prozerine is also known as neostigmine. Okay, now what this prozerine do? It basically, as we all know, we have a acetylcholinesterase. What does acetylcholinesterase do? It basically breaks the acetylcholine into two parts, acetyl and choline. And this process takes place in the synaptic cleft. Okay. Now, if we block the acetylcholinesterase, then the amount of acetylcholine in the synaptic cleft will be increased. And what it will do, when the amount of acetylcholine will be increased, it will act more and more on the receptor. When it will act more on the receptor, then increase the tone of the muscle. Okay. And we can say that it will basically restore the peristalsis. So this was all about the question number 76. Now let's move to the next question, the question number 77. The question number 77 states that a liquidator of a breakdown at a nuclear power plant who was irradiated complaining about vomiting that occurs all of a sudden. What medication should be prescribed? So in this question, basically, a worker who has been working in the nuclear power plant get irradiated with the harmful radiations from the nuclear power plant and later complains about vomiting. Now, what medication should be prescribed? We all know that for the vomiting, we have a drug that is known as the anti-emetic drugs. These anti-emetic drugs are basically the drugs that basically prevents vomiting. And we also have emetic drugs. Emetic means vomiting. Now, antiemetics will prevent vomiting, and what emetics will do? Emetics will basically induce vomiting. Now, these antiemetic drugs, these are classified into five major classes. These are classified into five major classes. We have cholinergic antagonist. Second, we have the H1 antihistaminic. Third, we have the neuroleptics. Fourth, we have the D2 receptor antagonist. And the fifth, we have the 5-HT4 receptor antagonist or 5-hydroxytryptamine receptor 4 antagonist. Okay. Now, in the cholinergic antagonist, we have a drug that is known as scopolamine. In H1 antihistaminic, we have two drugs that is promethazine and we also have diphenhydramine. In neuroleptics, we have chlorpromazine. Under the D2 receptor antagonist, we have metoclopramide. And in the 5-hydroxytryptamine 4 receptor antagonist, we have ondansetron. Okay, now what these antiemetic drugs do? These antiemetic drugs basically blocks the CTZ. CTZ. CTZ is basically a chemoreceptor trigger zone. And along with CTZ we have D2 receptor. These CTZ and the D2 receptor, they both are associated with vomiting, and they both are present in medulla oblongata. Okay, now what these drugs will do? These drugs will basically inhibit the D2 receptor and CTZ receptor. On these receptor inhibition, what we will have decrease in the urge of vomiting, and we can prevent vomiting in this case. So for this, we have various drugs. And from the options, you can see that it is given metoclopramide. What does this metoclopramide do? This metoclopramide basically is a D2 receptor antagonist. It basically blocks the D2 receptor or the dopamine 2 receptor. And once this D2 receptor is inhibited, it basically leads to decrease in the urge for the vomiting, and you can prevent the vomiting. Okay, so this was all about the question number 77. Now let's move to the next question, the question number 78. This question states that a patient with chronic cardiac insufficiency has been treated with cardiotonic drugs and a thiazide diuretic, but in spite of it there are still edema and risk of ascites. What medication should be prescribed to amplify diuretic effect of the applied drug? We have done this question earlier where we have talked about the hydrochlorothiazide, Lasix, the loop diuretics, and the brief mechanism of action about all these drugs, the hypokalemic drugs and the hyperkalemic drugs. So for that, please refer to the question number 9 in our very first video. Okay, now let's move to the next question, the question number 79. This question states that a patient ill with collagenesis has been taking prednisolone for a long time. Hypokalemia development caused spastic pain of skeletal muscles. What medication should be used in order to correct the potassium exchange? In this case, the patient is ill with collagenesis, and for the treatment he has been taking prednisolone for a long time. But later, due to the development of hypokalemia, he got problem with the spastic pain of skeletal muscles. What medication we can use to correct the potassium exchange? We all know that Prednisolone is a corticosteroid, and we all know that it has mechanism of action similar to the aldosterone. So what it will do, it will cause the retention of sodium and water. Now, if we will keep sodium inside the body, we must eliminate one of the positive ion to maintain the ionic balance. So we will remove or excrete potassium. Now once we remove the potassium, it will cause hypokalemia. Now in this question we have been asking how we can treat the condition hypokalemia. So we can treat hypokalemia by giving the potassium supplement drugs. So for that we can give the analog of potassium, that is Penangen. Penangen is basically a synthetic potassium. So when we will give patient potassium directly into the body, it will basically rise the or increases the level of potassium inside the body, and it will treat the condition, that is hypokalemia. Now let's move to the next question, the question number 80. The question number 80 states that a patient ill with essential hypertension was recommended a drug that prevents thrombosis. It is to be taken parenterally. What drug is it? So in this question, a patient has been ill with the hypertension, and we gave him a drug to prevent thrombosis. So what drug we must have given to prevent the thrombosis? So to prevent thrombosis, we can give him anticoagulants. We all know that thrombosis is basically a clot. So to prevent formation of clot, we can give him anticoagulant. And we all know that we have a very famous anticoagulant, that is heparin. Okay, now what does heparin do? This heparin basically, also known as the indirect anticoagulant. Okay, this heparin inhibits the clotting factors such as clotting factor number 2 and clotting factor number 10. In this case, where it inhibits the clotting factors number 2 and clotting factors number 10, it acts as direct anticoagulant. Whereas where it basically binds to antithrombin 3, it acts as a indirect anticoagulant. Okay, so what we get in this question? In this question, we need to prevent thrombosis, and we all know that thrombosis is basically the formation of clot. So for this, we can give the patient anticoagulants. The most famous anticoagulant we have been studying since our school, that is heparin. And heparin is an indirect as well as direct anticoagulant. When it inhibits the clotting factors number 2 and 10, it acts as a direct anticoagulant. But when it binds to the antithrombin third and increases its activity, it basically acts as indirect anticoagulant. Okay, so this was about the question number 80. Now let's move to the next question, the question number 81. The question number 81 states that a patient presents with blue light vision impairment. Which of the following vitamins should be administered? This is a very simple question, but please understand it. Okay, in this we have a disturbance in the twilight vision. What is the twilight vision? First of all, you need to know what is twilight vision. This twilight vision is also known as scotopic vision. Now, what is this scotopic vision? This scotopic vision is a condition where a person has the ability to see in dim light or reduced illumination. Now, whenever the twilight vision impairment occurs, it basically causes the condition. If the twilight vision has been decreased, the decrease in the twilight vision can lead to night myopia. And this night myopia is a condition where person cannot see clearly in dim light. Okay, you all know that in eyes we have two types of cells. We have rods and we have cones. The cones provide vision in daytime, whereas the rods provide vision in the night time. Okay, rod contains a pigment that is known as rhodopsin, whereas cones contains a pigment that is known as iodopsin. Both these pigments are made up of vitamin A. Okay, now whenever there is problem with the vision, we need to give patient analog of vitamin A, and we all know that retinol acetate is another name for the vitamin A. So the answer will be A, that is vitamin A. But the examiner can also ask you question by giving two words. What he can give you? He can give you two words, that is hemeralopia and nyctalopia. This hemeralopia is a word which is originated from two Greek words, that is hemera, which means day, and alos, which means blindness. So when we combine these two words, we can say that hemeralopia is a condition where patient cannot see clearly during day, and nyctalopia is basically exact opposite of the hemeralopia. Nyctalopia is also originated from two Greek words, that is nyx and alos. Nyx means night and alos means blindness. So we can say that nyctalopia is a condition in which patient cannot see clearly during night or during the dim light. In Greek, Hemera was the Greek goddess, or you can they also call it as goddess of day, and Nyx was also a Greek goddess. She was goddess of night. This was a brief about the etymology of these words hemeralopia and nyctalopia. Okay, now let's move to the next question, the question number 82. The question number 82 states that a female patient consulted a doctor about pain and limited movements in the knee joints. Which of the following non-steroid anti-inflammatory drugs should be administered, taking into consideration that the patient has history of chronic gastroduodenitis? In this, a patient consulted a doctor about pain and limited movements. So we must give him anti-inflammatory non-steroidal drug NSAID. And we must also keep in mind that he has history of chronic gastroduodenitis. We have discussed a similar question, that is question number 14. Please refer for the detailed mechanism of action to the question number 14. In this, what happens? We all know that we have Cox pathway. In the Cox pathway, we have COX-1 and the COX-2. We all know that COX-1 is responsible for protection of the stomach from HCl, whereas COX-2 basically forms during the or takes place during the pathological reactions or during inflammation. Now, if we will inhibit the complete COX pathway by giving non-selective NSAID or the non-selective non-steroidal anti-inflammatory drugs, for example indomethacin, both these COX-1 pathway and the COX-2 pathway will get inhibited, and once the COX-1 pathway will get inhibited, what it will do, it will basically cause the chances of disturbance of history of gastroduodenitis. So we need to give a selective COX-2 inhibitor that will only and only inhibit this. So for the selective COX-2 inhibitor, we have a drug that is celecoxib. Celecoxib is basically selective COX-2 inhibitor. It basically inhibits the COX-2 pathway and does not inhibit the COX-1. Now let's move to the next question, the question number 83. The question number 83 states that a 66-year-old female Patient got intravenous injection of magnesium sulfate solution for the purpose of elimination of hypertensive crisis. But arterial pressure didn't go down, and after repeated introduction of the same preparation there appeared sluggishness, slow response, inhibition of consciousness and respiration. What preparation is antagonist of magnesium sulfate and can eliminate the symptom of its overdose? So here, the patient got intravenous injection of magnesium sulfate for the elimination of hypertensive crisis, but arterial pressure didn't go down, and the doctor introduced the magnesium sulfate on a repeated mode, and on the introduction of the magnesium sulfate in repeated mode, it basically leads to the toxicity of the magnesium sulfate and shown the following symptoms, that is sluggishness, slow response, inhibition of consciousness and respiration. So what drug should we give to eliminate this overdose or to eliminate this condition? So I have told you earlier that for the antidote of magnesium sulfate, you will give calcium chloride. Calcium chloride. Okay, this is a point to learn. For the toxicity of magnesium sulfate, you will always give antidote calcium chloride and vice versa. Okay, now let's move to the next question, the question number 84. See, this question is similar to the question number 81. Okay, here the examiner gave you hemerolopia, and I have told you that what is hemerolopia? Hemerolopia is basically the day blindness. So for this case also we will give vitamin A. Why? We know that cones are responsible for day vision, and cones have a protein that is rhodopsin, that is basically form of the vitamin A. Okay, so we will give vitamin A to the patient. Now we have the question number 85. The question number 85 states that a patient underwent appendectomy. In the post-operative period, he has been taking an antibiotic. The patient complains about hearing impairment and vestibular disorders. What group of antibiotics has such by-effects? The patient underwent appendectomy, okay, and in the post-operative period, he took certain antibiotics. And after taking the antibiotics, he complains about hearing impairment and the vestibular disorders. What group of antibiotics the patient would have taken? So I told you this earlier in the question number, I think, question number 40 maybe. Question number 40, where we talked about the treatment for the tuberculosis. In that question, I told you about the different side effects of the various drugs such as isoniazid, rifampicin, streptomycin, and all. And there I also told you about that aminoglycosides are those drugs that basically leads to the vestibular disorders as side effects. That basically cause the ototoxicity. Oto means ear. Okay. In these aminoglycosides, we have various drugs such as gentamicin, kanamycin, and also streptomycin. And streptomycin is an anti-tuberculous drug. Okay, this was all about the question number 85. Now let's move to the next question, the question number 86. We have discussed this question also earlier. Please refer to the question number 2 for the detailed explanation. Okay, in this question we have a student came to see a doctor and asked to administer him a following drug for the treatment of allergic rhinitis that occurs in the period of linden flowering. What drug may be used? In that question I told you about that antihistaminic drugs are basically classified into two generations. We have the first generation and we have the second generation. Okay, the first generation basically crosses the blood-brain barrier and the examples are such as Benadryl, whereas the second does not cross the blood-brain barrier and the example is loratadine. So how we will know that we must give the drugs which do not cross the blood-brain barrier? In the question we have given a student came to see a doctor. So a student must attend the class during the treatment. So we must give him some drug that will not cause sedation. So what are those drugs? Those are basically the second generation antihistaminic drugs. These drugs basically do not cross the blood-brain barrier and prevent the patient from getting sedation. Okay. Now let's move to the next question, the question number 87. A 7-year-old child is ill with bronchitis. It is necessary to administer him an antibacterial drug. What drug of fluoroquinolone group is contraindicated at this age? This is a direct question. In this, the examiner have given or directly asked you that what drug of fluoroquinolone group is contraindicated. And we all know that fluoroquinolone groups are contains those drugs which end with the ending floxacin. So from the given option we have ciprofloxacin. The other examples of the fluoroquinolone antibiotics are moxifloxacin, moxifloxacin, and we have levofloxacin. What they do, they basically, the fluoroquinolone group basically inhibit the enzyme DNA gyrase, which basically inhibit replication. Okay. Now let's move to the next question, the question number 88. The question number 88 states that a patient has a dry cough. What non-narcotic antitussive will relieve the patient condition? So the patient is having dry cough and the examiner have asked that what non-narcotic antitussive drug will improve the patient's condition. So before getting into the question directly, you must know the difference between the antitussive and the expectorants. The antitussive are also known as suppressants and they basically suppresses the cough center. Okay, and they are used for the treatment of dry cough. Whereas we have expectorants. These expectorants are classified into two major classes. We have bronchosecretory, and we also have mucolytics. Now what these expectorants do, they basically expel mucus out. So we can say that these expectorants are used in the case of the wet cough or the cough with mucus. Now these antitussive drugs are classified into two groups. We have the drug of central action, and we have drug of peripheral action. In the drug of central action, we have opioid and non-opioid, or narcotic and non-narcotic. Under the opioids, we have codeine phosphate, codeine phosphate. We have codoterpene, and we have ethyl morphine hydrochloride, or simply we can say that morphine hydrochloride. Whereas in the case of the non-opioid, we have glycine hydrochloride, and we also have butamirate citrate. Okay, now these glycine hydrochloride basically inhibit medulla center of cuff. Okay, now we have drug of peripheral action. In this we have drug, a very famous drug, that is known as libaxine, also known as prenoxdiazine hydrochloride. Whereas if we talk about the expectorants, we have bronchosecretory and the mucolytic. Okay, and in these, the bronchosecretory are classified into two groups. We have reflexly acting, and we have directly acting. In the reflexly acting, we have infusion of thermopsis. We have infusion of thermopsis. We also have decoction of althea. We also have mucaltinum. What we have? Mucaltinum. Whereas for the directly acting, we have potassium iodide, and we also have sodium bicarbonate. Okay, and if we talk about the mucolytics, these mucolytics are also classified into two groups. We have the synthetic and we have the enzymes. In the synthetic, we have acetylcysteine. We also have ambroxol. Whereas if we talk about the enzymes, we have trypsin, we have chymotrypsin, and we have also ribonuclease. Okay, so here we have the patient is suffering from dry cough. So for the dry cough, we know that we must give antitussive, and antitussive are divided into the drug with the central action and with the peripheral action. In the central action, we have the opioid and the non-opioid. And in the question, they have been asking that we must give him non-opioid or the non-narcotic. So in the non-opioid we have glycine hydrochloride and the butamitrate citrate. So the answer will be A, glycine hydrochloride. Okay, now let's move to the next question, the question number 89. This question states that a patient has been diagnosed with transmural myocardial infarction. What drug should be given in order to prevent cardiogenic shock? So, what is transmural myocardial infarction? This transmural myocardial infarction is basically the necrosis of heart muscle. What it is basically necrosis of heart muscle. Now, which muscles? Those muscles which covers the entire thickness of entire wall of ventricles. Entire wall of ventricles. Okay, and in this condition, in the transmural myocardial infarction, the patient have intense pain. And in the question number 38, I told you that for the intense pain, we must give patient opioid analgesic. And which of the opioid analgesic mainly? Mainly Promadol. So the answer will be A, Promadol. For brief explanation, please refer to the question number 38. Now let's move to the next question, question number 90. This question states that a patient consulted a physician about muscle rigidity, constant movements, permanent arm tremor. The patient was diagnosed with Parkinson's disease. What preparation should be administered? So for the treatment of the Parkinson's disease. So what is basically the Parkinson's disease? This is basically a condition that is caused due to absence or decrease in a neurotransmitter that is dopamine. This dopamine is basically released from two areas of brain. First is substantia nigra and the other is ventral tegmental area. These are two areas which basically are responsible for the secretion of dopamine. Okay, now when this dopamine is not produced in adequate amount or there is decrease in the production of this neurotransmitter dopamine, it leads to a disease that is known as Parkinson's disease. And for the Parkinson's disease, we have main signs such as tremor, muscle rigidity, we also have hypokinesia, and we have hypersalivation. These are the symptoms of the Parkinson's disease. And for the treatment of the Parkinson's disease, for the treatment of the Parkinson's disease, there are basically two pharmacological management. We have the drugs which basically stimulate dopaminergic process. We have drug stimulate dopaminergic process or basically the neurons, and we have drugs which inhibit central cholinergic process. cholinergic process. In the drugs which stimulate dopaminergic process are levodopa. We also have Necom. We also have tropacine, and in the another group which basically inhibits the central cholinergic processes, we have cyclodol and we have tropacine. Now, in this condition, what we can do, we can basically give him a drug that will basically stimulate the dopaminergic process and it will basically increase the release of dopamine. So how does these drugs act? Now let's talk about the mechanism of action of the drugs. For example, let's talk about levodopa. Levodopa is basically the precursor of dopamine. Okay, now dopamine itself does not cross the blood-brain barrier. Okay, dopamine itself do not cross blood-brain barrier, but levodopa can be actively, it means with the help of certain chemicals or compounds, it can actively transport it to the CNS. Transported to CNS. Once it is transported to CNS, then it is then converted to dopamine. Okay, but to make the dopamine in the brain or in the central nervous system, we must administer levodopa in high amount. Why? Because some of levodopa can be decarboxylated to dopamine in periphery or in the peripheral part, not in the central nervous system. So we must give him levodopa in that amount that it reaches the central nervous system and there it get decarboxylated and gets changed into the dopamine. That will basically improve the condition of the Parkinson. Okay, so we have the following drugs over here. So among these drugs, only we have levodopa, that is the pharmacotherapy of Parkinson disease. Now let's move to the next question, the question number 91. The question number 91, we have done this question earlier from the question number 9 in the very first video. Okay, please refer to the question number 9. Now let's move to the next question, the question number 92. This question states that a patient with coronary artery disease was admitted to the cardiological department for stenocardia prevention. A drug from the group of beta adrenoreceptor blocker was administered. What drug is it? This question also we have discussed in the question number 51. where we basically talked about the antihypertensive drugs. In that, in the antihypertensive drugs, in one of the class that is neurotropic agents, we have a subclass that was the beta adrenoblockers, and among that we have the following drugs, that is metoprolol and atenolol. To learn the names of the beta blockers, basically the beta blockers are those drugs which end with the ending lol. Okay, so you can learn these by the trick that whenever in the drugs you will have lol in the ending, they will be the beta adrenoblockers. So in the options we have a drug that is metoprolol, that is a beta adrenoblocker. Now let's move to the next question, the question number 93. The question number 93 we have discussed earlier, where we have talked about the prozerine or the pseudoglutyrylcholinesterase. Okay, this we have discussed earlier in the question number 3. Now let's take a quick review about the question. A woman was delivered to the hospital for tracheal intubation. What of the following drugs should be applied in this case? So, what is tracheal intubation? Tracheal intubation is basically placement of flexible plastic tube in trachea. It is basically the placement of plastic flexible tube in trachea. Now, what is the need to do that? It is for those patient, if a patient become unconscious and he cannot breathe on its own, so we can place a flexible plastic tube in trachea to induce breathing. And this tracheal intubation is also used for the obstructed airways. Okay, now for the tracheal intubation we must introduce a tube inside the trachea or the windpipe. So for that we must have the need to relax the muscles. So we must give him muscle relaxant. And the most commonly used muscle relaxant is diethylenum. For the brief or detailed mechanism of action of diethylenum, please refer to the question number 3. Now the next question also we have done earlier in the where we have talked about the side effects of the isoniazid or the drugs, where we have read about the anti-tuberculous drugs. In that we read that isoniazid cause peripheral neuritis, peripheral neuritis or the neurological disorders, logical disorders. Okay, the rifampicin cause red body fluids, that is sweat and tears, sweat, tears, urine. Acetominophen leads to ototoxicity. Same, kanamycin also leads to ototoxicity as side effect. So in the question we have a patient was treated with pulmonary tuberculosis, and during the treatment he got neuritis of the visual nerve, and it would have been caused due to the use of the anti-tuberculous drug isoniazid. Okay, now let's move to the next question, the question number 95. This question also we have done earlier, the very first question. It is the very first question where I have told you that metronidazole is contraindicated with alcohol. Indicated with alcohol. Okay. Now let's move to the next question. We have also done this question also. For this question also, we like where we have talked about the digitoxin, and we have 2-3 questions like this where we have talked about digitoxin, digitalis group. In one question we have talked about the strophanthin group, and there I told you that if in Krok you get questions such as chronic heart failure or chronic ventricular insufficiency or chronic left ventricular insufficiency, chronic right ventricular insufficiency, the choice of drug will be digoxin or digitoxin. Whereas in case of the acute, the choice of drug will be corglycum. That basically belongs to strophanthin group. And this digitoxin belongs to digitalis group. Okay. Now we have done this question also. Now in this question we have a patient is ill with chronic cardiac insufficiency and he was prescribed therapeutic dose of digitoxin. 2 weeks later he appeared symptoms of drug intoxication with the following symptoms such as bradycardia, extrasystole, and nausea. Name the phenomenon that caused accumulation of the drug. In the case of the material accumulation, we have drug plus effect both. Whereas in case of the functional, we do not have drug, but the effect due to the drug is still present. But in the question, it is given that we have accumulation of the drug, so the answer will be material accumulation. Now let's move to the next question, the question number 98. A patient with drug intoxication presented with dryness of oral mucosal membrane and midriatic pupil. Such action of drug is associated with the following effect. Now, we all know that the dryness of oral mucosa as well as midriatic pupil is caused due to activation of sympathetic nervous system. And when the sympathetic nervous system would have activated on the parallel hand on the parallel side, it would have basically inhibited the parasympathetic nervous system, and for the inhibition of parasympathetic nervous system it must have inhibited the cholinergic receptors or the cholinereceptors. So the answer will be muscarinic cholinereceptor blockage, and the M receptor are present in eye as well as GIT for secretion. and once this will get blocked, it will basically leads to the reduction in the secretion of GIT juice, as well as dilation of pupil. Okay, now let's move to the next question, the question number 99. A patient with ischemic heart disease has been taking an anti-anginal drug that reduces the myocardial oxygen consumption and blood supply of myocardium. What drug is it? Now, when when we discussed about the anti-anginal drugs previously, we got various classes in that. One class was that the drug which basically reduces the oxygen supply of myocardium and increases the oxygen supply of myocardium, and in that class we have a drug that was nitroglycerin. So it is a direct question from the classification. Please refer to the anti-anginal drug classification which we have studied earlier. Okay, I don't remember the question exactly, but you will find it in the previous videos, or please first of all see the base. In the base, look for the question in which question they have asked about the nitroglycerin, and according to that question number, please refer to the video. In that video you will find the question with that brief explanation. In that I have talked about the anti-anginal drugs classification as whole, as well as about the mechanism of action of the nitroglycerin. Okay. Now the next question, the question number 100, it says that an patient, again they are doing the same mistakes. So we have a patient with insomnia reduced by allergic rash and itch has been prescribed the drug that has antihistaminic and the hypnotic effect. Specify the drug. So here we have antihistaminic drug with the hypnotic effect. Okay, and we know that antihistaminic drugs are classified into the first generation and the second generation. The first generation are those which do not cross which crosses the blood-brain barrier, and the second generation do not cross blood-brain barrier. And in the second generation we have loratadine as well as cetirizine, whereas in the first generation the drugs which basically crosses the blood-brain barrier, we have Benadryl as well as morphine. So you have Benadryl in the option, so the answer will be A, Benadryl. Why Benadryl? Because in the question that the examiner has given that the patient has hypnotic effect. Hypnotic effect means the drug would have crosses the blood-brain barrier and caused sedation, and that sedation would have caused hypnotic effect. Okay, that's all for today. If you enjoyed this video and want to hear from me again, be sure to hit the subscribe button before you go, and don't forget to like, share and comment. So for the time, namaste, फिर मिलेंगे.